How about now? Can you sit now?
I think you can just go ahead. It's not from your end, it's from here. We're having.
Sorry?
Eh,
Yeah, hi. Oh, no. So should I go ahead then?
yes, please.
Okay. Thank you again, everyone, for joining us. And I'm really sorry that I couldn't be there physically. I was supposed to be there with everyone and to meet everybody, but life happens. So I hope we've been having a very great program up till now. Our topic today is, ensuring a healthy remote work life, teaching us how to navigate physical and mental well-being for remote and virtual workers. So I work in clinical research and I work remotely for the vast majority of my time at work. And what that means is I'm typically in this position, like many of us are, typically just like this, like sitting at your table, at your desk, in your home or in your workstation at work. And I just want to teach us how we can be healthier while we work remotely and while we work in the virtual space. Teach us how to be healthier from a medical and mental, point of view. So again, when you work remotely, it means you're in a different space from where maybe your office is. So you work from an offsite location, you're working from your home. And when you work from home, you're in your comfort zone. One of the things that happens when you work from home is you might not have a beginning and an end to your typical workday. Like other people who wake up, get dressed, have some activities in the morning, and then go to work, you're more flexible. That flexibility is a very good advantage, but it also comes with its own challenges, such as isolation and lack of social interaction. So if you live alone, you don't have a family yet, maybe you're not married, you might end up spending days without talking to anybody other than on a screen, and even if you have family members around you, say you have got kids, you might end up, spending a large volume of your time walled off away from them, sequestered in meetings, or trying to finish your tasks, within your set timelines. You might also end up being very sedentary because most of your activities are taking place just on a table at a desk. You don't have to get up, jump a bus, catch a train, drive. You don't have to leave your room even if your workstation is in your room. So there's a lot of sedentary living, reduction in your physical activity. And then there's the potential again for overwork and burnout. As I mentioned earlier, a lot of people who work in this space end up not really having a proper start and close time, no proper beginning or end to the day. Everything is just blurring into everything else. Every day is just blurring from one day to the next. And that's very challenging because you need to take a mental break from work for you to, declutter your brain, for you to, get back into your zen mode, for you to connect with other people. But you end up not being able to do that sometimes because you're just working. Your boss is sending messages at 11 p.m. if they're like me sometimes, because that's when the ideas come. So you need to learn how to, set those boundaries and create the best and the most optimal way to work from your home. And to balance your physical and your mental health when it comes to working remotely, again, you have to have that balance between your physical and your mental health. You have to balance what you do, your work life, with your home life, with your social life, with just living. You shouldn't live to just work. You should be able to work and still have an actual productive life outside of your office hours. You should be able to have time to make yourself a complete and a total human being where your well-being is important. So your creativity, your productivity, your resilience, and all of those things that make you a very good member of the team at work and a very good member of society. You need to balance all of those. I'm going to be sharing with us a few tips to help us, improve our balancing of our physical and our mental health. You can exercise regularly. If you're at a table like mine, right, you can stand up and take regular breaks between one task and the other. You can stand up and take a walk. And all of those walks should not be walks to the kitchen to go grab a snack or cook another pot of jollof rice or something. You should be able to stand up, take a 10-minute walk, take your eyes off the screen, protect your eyes, wear glasses like mine that are anti-reflective, even if you don't have maybe astigmatism or any other eye effects. You should be able to stand up, walk away, so that you're giving your body a physical break and some exercise. WHO recommends 10,000 steps per day to keep, yourself healthy as the minimum sort of exercise. You cannot get 10,000 steps by sitting in your house. What some people who have the means do is they get standing desks. So the desk is higher than a sitting desk. This is a sitting desk where you have a chair and a table. Some who get standing desks, which are higher, and so they stand at their desk. It gives them a bit of exercise. It prevents the sedentary living that we're talking about. Some people get exercise chairs or exercise bikes, and then they have this whole setup where they have like an exercise bike, or they exercise at work. You can, because it's your home, you're working from your house most of the time. If you're working virtually, you can incorporate regular breaks where you have, yoga or some other side of exercise. The key is to make sure that you exercise daily. So you're not doing traffic, you can replace your traffic time with morning gym, or you can take evening walks as well. So all of those are regular things that, or are just examples of things that you can do regularly. You should also try to sleep really well. At the very minimum, for you to live a very healthy life, you must balance at least 6 to 7 hours of sleep, which is good because you're not spending a lot of time in traffic. So you can take maybe an hour or two from what would have been your traffic time to prioritize your sleep. The problem comes when people who work remotely have a very messed up circadian rhythm, which means they are awake in the night, they are asleep in the morning. All of those, their sleep-wake cycle is disrupted. It's not optimal. You can regulate it. You can discuss it with your doctor if you suffer from something like insomnia. If the work pressures and the stress is preventing you from sleeping, you can talk about those as well. And if it is stress that is causing you to have maybe insomnia and is disrupting your sleep, you can modulate that with your bosses at work and discuss it with your supervisors. If it is just insomnia and you don't really know what's happening, or you have a condition like sleep apnea or something, you can also discuss those with your doctors. But the truth is, poor sleep has been associated, just like with obesity, with a lot of cardiovascular diseases and cancers. So you want to reduce your risk of getting cancers or cardiovascular diseases by making sure that you sleep very well. Again, if you're stressed, you can try mindfulness and relaxation techniques. Some of those are just you taking breathing exercises. So you breathe in, you breathe out, you do a few things like that, and it's very helpful. A lot of people have reported a lot of benefits from mindfulness. Mindfulness means being conscious in time and place. So you have a consciousness of who you are, what you're doing, where you are, and you have an appreciation for your position at that moment. You can try breathing exercises, you can try stretching. People like yoga, it's very helpful. You can also try to set realistic goals. Don't start your day with a very long to-do list, and then you're very overwhelmed before you even begin to do anything for the day. One of the things you can do is to set and space your time and your goals. So you can have short-term, long-term, medium-term goals, which are all, balanced and realistic with the amount of time that you need to spend on those goals, the amount of time that you need, with the factors that are outside of your control as well. You can establish healthy routines. So make sure that your days are not jumbled. Try to know sort of things that you can do to improve your day. So you can have a routine. Again, maybe go to the gym in the morning. On your way back, you can maybe stop at the corner shop and get something that you need for the day, maybe to meal prep. You get to your house, you set up your breakfast, you get your desk, check your emails. So this, what I'm describing now, is my morning routine, and that's how my day tends to go. So you move around and you do all the little things that you're supposed to do. You make while you're making your phone calls, and then you settle down for your meetings, however you have them scheduled. You do your tasks, and then you close your day at whatever your closing time is, right? And make sure that the goals that you've set for that day are all achievable within the time frame of that day. If you have very good prioritization and time planning skills, you should be able to do a very good job within the normal 40-hour work week that most people have. You need to prioritize maintaining social connections. If you're in an abusive relationship, for example, people say that the first sign of an abusive relationship is when they try to ostracize you from everybody else. Don't be in an abusive relationship with your own self. Okay? Don't become the toxic partner in your own life, right? You need to make sure that you have very good social connections. So meet up with your family, have regular girl trip, have regular touch base, hang out periods with your friends. If you're married, have date nights, have family nights, things like that, family movie nights. These are all things that I try to do, and so it's possible for you to do them as well. Make sure that the time that you spend your family is there's a block of time that you know that this is the period when I spend time with my family outside of just work. You can also try to ensure social interactions like church for those who are spiritual, who believe in such things. It's helpful. Sports, so go play a game with your colleagues, with your friends. It's helpful. Attend events. Things like that are available on Eventbrite, for example, and then you can make new friends from there and expand your social capital, and that's very beneficial. Take breaks and practice self-care. So I've talked about taking breaks, regular breaks, within the course of the day, but I haven't talked about taking proper breaks within set time frames. So I have noticed that most Nigerians like to, not just Nigerians, most people who work tend to take their leave bonus and use it for something that is not a leave. Your leave period is supposed to be for rest. It's not the time that you're supposed to take because you're sick. Your sick time is different from your leave time. So if you're ill, call in for a sick day. When you are on leave, try and take time, those blocks of time, to do things that will refresh your soul, to do things that will make you feel better, to do things that will put you at ease, and spend your own money sometimes on your own self, so that you feel like you're working and you're earning a living and you're also enjoying the rewards of those things. Can be very bolstering for the person's mental health. Those periods of those where you have those breaks, you can also practice self-care. Choose a spa day, do something for your skin, treat your hair, just those things that help the body that you live in. Another funny thing, not really a funny thing, but another important thing that you should also take time to do is to have your regular health checks, right? So part of your self-care is taking care of yourself. As I said, don't be in an abusive relationship with yourself. Use your body wisely. It's the only one you have. Take time to take yourself to the hospital and have your annual checkups done according to your age. They will recommend some investigations for you. They will review those investigations. And if you're having a regular average job, it shouldn't cost you maybe 100,000 naira per annum to get a wellness check, which I think is very beneficial. If you have a health insurance plan, it might even cost you less or nothing at all. Seek professional support. If you know that you are struggling mentally, seek mental health support. Part of seeking professional support is taking yourself for a wellness check with your doctor. Seek professional support for your physical health. Finding out that you sit in a chair like this all day might predispose you to, some back problems. So between your scapula, your neck, because you're low, so your computer should actually be a little bit higher so that it's at eye level with you. That's called ergonomy, and then we'll get into, an ergonomic setup for your desk in a minute. But part of the things that you should do is to have a desk, for example, that can be at eye level, a computer setup that's at eye level, that's at eye level for you, preventing some of those back pains that you might need professional support with. So back pain, upper back pain, cervical pain along your neck, maybe lumbar sprain even, which is like a very low back pain, hip issues, resting your hands on a desk like that can cause some carpal tunnel problems, which are like some numbness or some pain in some parts of your hands, thereabouts, like this place or over here, when your nerves are pressed and pinched because of the position that you tend to put your hands in. Arthritis from repetitive use of your hands in certain positions where this is all you do all day. So you can take breaks from typing and refreshing your hands. You can do warm soaks, just take care of yourself and talk to your professional about, any other tips that they have that can help you take care of yourself. Practice gratitude and positivity. It's just, again, similar to mindfulness. So just that constant reminder of where you're coming from and how far you've come. It helps you see time in a more objective way, not just your eyes set on your goals, what you're trying to do in front of you, but also looking back to see where you're coming from and how far you've come and the changes that you've made that have brought you here. And it will help you make better decisions as you go forward. Set boundaries, like those bosses that call you at 11 o'clock, for example. You can try to put your phone on do not disturb from maybe 7 p.m. or 8 p.m. so that everybody knows that these are your work hours. If you keep getting requests outside of your work hours, have a discussion. It's okay. It's within your rights to have a discussion to say, please, can we reschedule this call till morning? Because studies have shown that a lot of the calls that people tend to take during the work, after work, can actually be done during work. If you're not working in a healthcare setting where somebody's life is hanging in the balance or their financial life is about to be ruined or something, if it can wait till a proper work hour, as I said, do everything you can within your work hour and try not to do anything outside of your work hours so that you can have very good amounts of time for social interactions. So set boundaries if you continually get requests to do tasks outside of your, of your work hours, just because your brain also needs time to rest, not because you are running from the work or something, because your brain needs to recalibrate, and it's very important for your well-being. Engage in hobbies and creative outlets. I cook. Personally, I enjoy cooking, swimming, reading, writing, and that's just me. Other people might enjoy hiking, biking. Some other people enjoy watching movies. Take time to Netflix and chill. Whatever it is that you do that makes you happy, take time to volunteer, go help the needy, go to church, join the ushering team, something that makes you happy, that is very you, and is a creative outlet for you. I paint. In fact, I'll share this. One of the most stressful periods of my life was being a house officer as a doctor. It was really stressful. I had my family, married with children, and then I'm having the busiest part of my life as I started my career. And one of the things that helped me through that period was painting. I developed a love of painting, and I started to express, and it was very beneficial for me. When I started it, and I think I shared it on Twitter, and then somebody saw it, and I was like, "Oh, you paint? There's a group, Art in Medicine," and I had never heard about them. And so because I had expressed my creative outlet, I was able to find another community as well outside of what I normally do, and that was very beneficial for my mental health because I was able to find support within that group. So those creative outlets are very important for you because they really help you to find community around yourself, people with like-minded interests, which will get you out of the house more often and help you with your socialization skills and help you with your mental health. So it all ties back together. There's no person, there's no health without mental health. It's all together, right? How well you will be doing. Ensuring physical well-being. I've covered most of this. Daily physical activity will boost your energy levels, it will improve your mood, it helps your digestion, it helps you to have very good cardiovascular health. It makes you stronger, fit, makes you more flexible. It helps keep you, healthier for longer. You live longer. You prevent things like obesity and cancer as well. Set up an ergonomic workstation and a workspace, your work desk. Make sure that all the things that you need are within reach so that your table is tidy. It's better for you when your table is tidy and well organized because then you're better able to focus. And that's very beneficial for you. I'm going to share a couple of pictures of what an ergonomic workstation should look like. You can make it, you can beautify it to whatever you like, and you can make it be a reflection of yourself. But be conscious of your chair. Make sure that the chair that you're sitting on has good back support and neck support as well. Make sure that it's at a good height for your hands so that when you're typing, it's comfortable. Make sure that you don't have to bend or arch over like this or stretch like this so that your spine is well aligned. Make sure that your computer is preferably at eye level. Mine isn't at eye level right now for a presentation like this, but at eye level you look more along this line so you don't have to bend your neck. A lot of people these days, yeah, sorry, 10 minutes more. Yeah, no problem. This is really fast. I only have very few slides, but thank you. So ensuring physical well-being is a very important part of it is having your very ergonomic workspace. Proper chair height, the position of your monitor, and your keyboard placement, they're all very, very essential, as I've mentioned. So another very important thing is to maintain a balanced diet. So as I said, your exercise does not include walking to the kitchen to get food and snacks. Just make sure that you're picking healthier food and snacks. You don't have to pick chocolates all the time. You can do carrots, for example. So you want to avoid processed food, sugary snacks, and things of that nature. You can do freshly squeezed orange juice rather than buying store-bought juice. So things like that can really help you reduce your calorie intake, thereby reducing obesity, which will then reduce things like your chance of getting things like cancer or arthritis down the line. So these are some ergonomic workstations. If you take a look at the chair on this end, it's really very, very comfortable. The monitor is at very good height. If you look at where the monitor is to where the neck of the chair is, you'd see that the person's head is going to be at eye level with that monitor. The mouse pad, everything is within reach. There's a space there for a stack of files if necessary, and that chair also swivels. There's which will make it very comfortable. There's a plant there which will lift your mood, and it's close to a light source. The same thing with this other one as well. That's a very comfortable chair. This other one has got more people in one workstation, but at least you can see how all the things are aligned in this workstation as well, where the books and everything is around, and the person you can actually focus. But the first two are better examples of a very good decluttered workstation than the other one because one one helps you focus more, while the other one is a shared space, so it's a little bit different. So I've discussed establishing a daily routine, and allocating time for work, breaks, meals, and relaxation. We've talked about mindfulness and meditation. We've talked about the benefits of maintaining social connections, how it can help you foster physical and virtual social interactions with your colleagues, your family, and your friends. You can use video calls, messaging platforms, and virtual events to stay connected. Virtual events like this, where you can, be part of a conference, even remotely. They're very helpful for ensuring that you don't feel isolated and you don't feel alone, and that you have people to talk to when you're feeling any type of way. How do you manage stress at work? Prioritization and time management. I've mentioned them earlier. You can use productivity tools to manage your tasks. If you're having trouble understanding what you should do first, you can write them all out. A to-do list is very beneficial. You can prioritize the tasks based on the urgency and the importance of what is there to do to avoid being overwhelmed. You can set boundaries. So establish clear boundaries between your work and your personal life. If there are people at work that you need to understand what you do and your availability, you should convey your time and your availability to other people so that they know when to reach you and how best to reach you within the work hours. It's okay to say no, right? It's very okay to say no. In our culture, in this part of the world, we're not very comfortable being confrontational or talking about or setting boundaries. It feels like you're coming off road, but it's okay to say no when something's outside of your comfort zone and outside of your work hours and you're well within your rights. You should speak up because it helps your mental health when you've spoken up and defended yourself as well. Seek support and use any resources that have been provided for you. So employee assistance programs, counseling services, online resources. There are a lot of mental health groups, support groups. There are a lot of corporate support groups as well. So you can, reach out to any one of them if you're having some challenges. There's always people who are willing to help and assist you. You can reach out to me and I will be happy to direct you to the right sources. Take time out. I've discussed that, using your leave and asking for time off when you need it. The problem is a lot of people in this environment. As a medical officer, I've had people who took time off because maybe they felt some type of way and they wanted to rest and they stayed home and they didn't go to any hospital to report it that they were feeling ill. And so their management started to take those days back. If you're feeling sick, go to a facility, go to a hospital. Even if it's just burnout, mental, not just physical in your body, even if it's your head space is not in the right place, you can go to your hospital and tell them and report everything, have it documented in your case note, and then they can issue you 2, 3, 4 days off work for you to recuperate. But when you stay at home, your managers might come back and tell you they'll take those days back, and that's where people go wrong. You're allowed to go to the hospital and explain your symptoms to a doctor and tell them and explain to them, and part of your evaluation will determine if you need that time off, and then they will be happy to give you that time off, and it's documented, and your place of work has to honor it, But if you don't have that documented, you're not likely to get away with taking that time off. And those days that you take off when you need them are different from your regular leave, right? So don't hesitate to seek help or guidance when you need it. Here are the key takeaways. Your mental health is very important, and it's just as important as your physical well-being. What's going on in your head will affect what's going on in the rest of your life, in the rest of your body. You should create a functional workspace and an ergonomic workstation, such that all the things that you need for your work day are present. Have your pen, your highlighter, your computer, all of those things are within reach. You should establish healthy routines, habits, diets, and exercise every day so that you're living the best possible life that you can. Prioritizing your well-being and reducing stress are also very important because it will help your mental space be clear and help your physical life as well, help your interaction with other people, give you a hitch-free work environment, and it's okay to take time off. Right? Don't avoid, or as long as you do it in the right way. And I think that's the end of it. Thank you very much for your time, and I hope that this has helped somebody. Thank you. And if there are any questions, I'll be happy to take them.
Dr. Folasade, for that very...
Can you guys hear me?
Yes, we can. Can you hear me? Thank you so much, Dr. Folasade, for that very enlightening session. So right now, we'll just be taking questions. So we'll be taking 3 questions quickly, or 2, 3 questions, and you'd please help to answer those questions as fast as you can, as quickly as you can, please. Thank you so much. So can we have, 1? Let's have questions. I think we'll just take 2. Okay, 2. All right, thank you very much. Please come forward.
Thank you, Dr. Folasade Olugbemi-Paul, for this session. It was very enlightening. Yeah, so I heard about meditation. So I would like to ask how meditation is a kind of a medical, how does it help us as virtual assistants? And two, I would like to know, you're a medical doctor. I'm also a medical worker. So I would like to know what services does a medical doctor needs a virtual assistant for? Yeah, thank you.
Okay.
Thank you very
I'll
much.
address the first one. And the first question, thank you very much for your question. Your first
Sorry.
question is about mindfulness and how you can use mindfulness to help your physical and your mental health. Imagine if you're having a very upset day and you're very angry and you're pissed off, for example, and you didn't sleep well the previous night and your heart rate is, increasing and your heart is beating fast. Take a minute. Try and find some calm within your center. Listen to some of those meditation tips. They are available everywhere. They talk very quietly and very slowly like this. And they tell you to breathe in and breathe out. It's very calming. It's very calming and it's very beneficial. And studies have shown that a lot of people have good success with it. So I would ask you to go online and look up meditation. And I'd ask not just you ask the question, but everybody to go and look up medication and how you can meditation and how you can use it to improve your own health. Okay? It's there and it's very, very common. It's very medical. As to what I do, I work in pharmaceutical medicine. That's my specialty. And working as a pharmaceutical physician and as a clinical medical advisor, I have a personal assistant, right? And my personal assistant we're an asset light company. My personal assistant and the rest of the team, actually, they don't work with me. We don't have a physical location where we typically congregate. No. In this space, in this type of work, we use telemedicine a lot. So most of the things that go on a computer. So even the assistants, my first assistant was I think for Airport, I was in Lagos then, right? So I have never met some of the people I work with. And that's how this field is. So yes, virtual assistants exist in my line of work. They help with scheduling, they help with taking minutes of meetings, they help with logistics, and a host of other things. They help with interview processes, and it's just a whole lot of meetings, back and forth emails that go on. So yeah, you're very useful in our field as well. And I would ask you to find a role within our field. Almost everybody in this field works remotely. So you guys will be perfect within our field. I'll take the next question.
Okay.
All right. Can you hear me?
Yes.
Okay, and thank you so much, Dr. Falashade. So you mentioned earlier, I should face everyone. Okay. So you mentioned earlier that we should do health or wellness check regularly. So I would just like to know, like for me, I actually do not do that. And only probably when I fall sick, I have to go to the hospital. I don't know about others, but that's for me personally. So how regularly do you advise that a regular wellness or health check be done by a remote worker, someone that works remotely?
Okay, so in Nigeria, and that's a good question. In Nigeria, a lot of people have we call it in medicine, we call it poor health seeking habits, where they only come to the hospital when they're ill. The hospital is not just for sick people, it's for healthy people as well. It's for healthy people who want to stay healthy. Don't only go to the hospital when you're sick. That's the wrong way to use health services. If you go, in medicine, we have treatments and we have management and we have preventive medicine. Preventive medicine is that branch of medicine that deals with everything that concerns you before you get sick to make sure that you don't get sick. Part of this discussion right now is preventive medicine, public health, where I am telling you that you can go into the hospital even before you're ill and go talk to them. If you're bothered about something, you can go talk about your mental health and your struggles. They'll listen and they'll direct you to the best services or provide point of care service for you at that moment. If it is your wellness check, it is best done annually. Every year, you should take some time, have some blood tests done. Some of the common tests that are done every year are HIV, hepatitis, malaria, kidney function test, liver function test. They check your heart, they check your kidneys, they check all of those major parts of your body. If you have complaints at the time of your annual wellness, they will also address those complaints that you have at that time. So say you came there and you're there for your regular wellness, but you have a tummy ache. They can treat that tummy ache or screen for whatever else could be causing tummy ache at that time. The human body is a bit like a machine. There are wear and tears that occur and they compound. So your body doesn't break down just the day that you fell sick. It's probably been warning you and you didn't know you were being warned, making some kind of sounds like a car that is kind of like faulty, but not too faulty, and you're still moving around. You don't wait until the day the engine is knocking to now say you want to take that car to the mechanic. You take it when the sounds are there. You also take it sometimes if you know you want to have a trip and you just don't want issues on the way. It's not until you're on the road that you now have issues, you now park somewhere in Ogun State. You will just be in trouble. So it's better for you to go and have a wellness check and say, is this car okay to keep moving for the next 6 months? And that's called what? That's called maintenance. I'm taking my car in for servicing. If we service our cars and we maintain our vehicles and our machines, how much more our body? Especially if you're sexually active, there are hepatitis vaccines as well that you can, hepatitis vaccines and HPV, human papillomavirus vaccines as well that you can take. The typhoid vaccines. Some of those things are not even known to many people because they don't go to the hospital and have discussions around preventive medicine and public health. So I would enjoin everyone who's here, depending on your age. Breast cancer is another one that you want to go screen for if you're female, and you want to go check. And you can do the self-breast examination by yourself, or you can have a doctor do it for you. But at least do all these things at least once a year. And you can be sure that you have a clean bill of health, and it's called a fitness certificate. You can be sure that you have a fitness check every year. The older you get, some of those tests are done every 3 years. Like the HPV cervical screening one is every 3 years. Some of them are every 5 years. Like your breast scan and stuff like that. But the older you get, or if something is picked, you can do more frequently, or you can, so it becomes flexible at that point. I think that's the 2 questions that we were going to take.
Yes. Thank you so much, Dr. Folasade Olugbemi. Thank you so much. We are indeed very grateful. Thank you so much. And have a wonderful day, Ma. All right.